Activated charcoal can cause cardiac arrest, low blood pressure, shortness of breath, irregular heartbeat, and a long list of even darker side effects that no one else is talking about. Stay tuned. Welcome to Healthy Food IQ, where we do more than just explore the benefits of your favorite foods. We also do a deep dive into scientific studies and reveal their dark and scary side effects that might be lurking in every bite or sip. Then we will recommend supplements and best practices to help you avoid these side effects. Hit that like and subscribe button for us to continually improve your healthy food IQ. Beneath the sleek black allure of activated charcoal lies a chilling truth. What if the very substance promising purity is, in fact, a silent saboteur? In this video, we pull back the veil on the 18 dark side effects of activated charcoal, revealing a landscape of hidden dangers that will leave you questioning everything you thought you knew. Imagine the promise of detoxification morphing into a nightmare of intestinal blockages, the illusion of cleansing giving way to life-threatening respiratory distress. We journey through a labyrinth of potential horrors, from the subtle disruptions of nutrient malabsorption to the terrifying specter of shortness of breath, and so much more. Witness the unsuspecting ways activated charcoal can manipulate your body, turning trusted medications into useless placebos and masking the stealthy advancement of serious illnesses. Feel the suspense as we expose the potential for severe allergic reactions and the subtle erosion of your gut's delicate balance. This isn't just a video, it's a descent into the shadows with our magnifying glass, a confrontation of the naked reality about what you are really consuming. Prepare to be unsettled, prepare to be captivated, and prepare to question everything. The truth about activated charcoal is far more sinister than you ever imagined. But beware, once you see, you can never unsee. Number 18, constipation. According to the National Institute of Medicine, PubMed, activated charcoal's highly porous structure allows it to bind to a wide range of substances in the digestive tract, including water, effectively slowing down the passage of stool. This binding action can lead to significant dehydration of the stool, making it harder and more difficult to pass, resulting in constipation. This is particularly concerning for individuals who already struggle with irregular bowel movements or those who fail to consume adequate fiber and fluids, as the charcoal exacerbates pre-existing issues. The disruption of normal bowel function can lead to increased abdominal pressure and discomfort, potentially causing hemorrhoids or anal fissures due to excessive straining. Symptoms may include infrequent bowel movements, hard stools, abdominal discomfort, bloating, straining during bowel movements, and rectal pain. Number 17, nausea and vomiting. The abrasive texture and adsorptive properties of activated charcoal can irritate the delicate lining of the stomach and esophagus, triggering nausea and vomiting. This is particularly pronounced when charcoal is ingested on an empty stomach, as there is no food to buffer its effects. The body's natural response to this irritation is to expel the substance, leading to vomiting. The potential for vomiting can also lead to dehydration and electrolyte imbalances, further compounding digestive distress. Frequent episodes of nausea and vomiting can disrupt daily routines and lead to a diminished quality of life. Symptoms may include nausea, vomiting, stomach cramps, dizziness, loss of appetite, and dehydration. Number 16, abdominal cramps. As activated charcoal moves through the intestines, its binding action can alter the consistency and motility of the bowel contents. According to the National Institute of Medicine, PubMed, this alteration can lead to spasms and contractions of the intestinal muscles, resulting in abdominal cramps. The severity of these cramps can vary depending on the dosage of charcoal and individual sensitivity. These cramps can be particularly distressing during bowel movements, as the increased pressure and straining can exacerbate the discomfort. The unpredictable nature of these cramps can lead to anxiety and a reluctance to engage in normal activities. Symptoms may include abdominal pain, cramping, bloating, gas, discomfort during bowel movements, and changes in bowel habits. Number 15, dehydration. Activated charcoal's ability to bind to water molecules within the digestive tract can significantly reduce the amount of water available for absorption into the body. This can lead to a state of dehydration, particularly if fluid intake is not significantly increased to compensate. According to the National Institute of Medicine, PubMed, the kidneys, responsible for filtering waste products, are placed under increased strain when the body is dehydrated, as they must work harder to conserve water. Dehydration can also disrupt the delicate balance of electrolytes, leading to muscle cramps, fatigue, and even cardiac arrhythmias in severe cases. Symptoms may include increased thirst, dry mouth, headache, dizziness, muscle cramps, and dark urine. Number 14. Nutrient malabsorption. According to the National Institute of Medicine, PubMed, the indiscriminate binding action of activated charcoal extends to essential vitamins and minerals, preventing their absorption from the digestive tract. This means that even though activated charcoal shots, smoothies, puddings, and baked goods have been popular on social media, once it is added to any food, that item, along with everything else in the stomach for the next 2 hours, will be of no nutritional value and would be like consuming mud. Every nutrient, mineral, or vitamin would be instantly neutralized. This can lead to deficiencies in vital nutrients, such as iron, calcium, and B vitamins, if consumed with any food or drink for at least 2 hours after consumption. Long-term use of activated charcoal can therefore lead to a state of chronic nutrient deficiency, impacting overall health and well-being. Symptoms may include fatigue, weakness, hair loss, brittle nails, impaired immune function, and digestive problems. Number 13. Drug interactions. According to the National Institute of Medicine, PubMed, activated charcoal's ability to bind to a wide range of substances makes it a potent inhibitor of drug absorption. This can significantly reduce the effectiveness of medications, potentially leading to treatment failure. This is particularly concerning for individuals taking essential medications, such as birth control pills, thyroid hormones, or heart medications, as compromised drug efficacy can have severe consequences. The timing of activated charcoal consumption relative to medication intake is crucial, as even a short interval can significantly reduce drug absorption. Symptoms may include reduced medication effectiveness, worsened symptoms of underlying conditions, anxiety, increased risk of complications from untreated conditions, and unexpected side effects due to drug interactions. Number 12. Respiratory issues. According to the American Lung Association, aspiration of activated charcoal into the lungs, particularly in individuals with swallowing difficulties or impaired consciousness, can lead to severe respiratory complications. The fine particles of charcoal can cause inflammation and obstruction of the airways, leading to pneumonia and even respiratory failure. This is a medical emergency that requires immediate intervention. The risk of aspiration is heightened when activated charcoal is taken in large quantities or when it is mixed with liquids that are easily aspirated. Symptoms may include coughing, shortness of breath, chest pain, wheezing, fever, and difficulty breathing. Number 11. Electrolyte imbalances. According to the National Kidney Foundation, activated charcoal can bind to electrolytes, such as potassium, sodium, and magnesium, within the digestive tract, preventing their absorption and leading to imbalances. These imbalances can disrupt crucial bodily functions, including nerve transmission, muscle contraction, and heart rhythm. Individuals with pre-existing kidney problems are particularly vulnerable to electrolyte disturbances, as their kidneys may be unable to compensate for the losses. Severe electrolyte imbalances can lead to cardiac arrhythmias, seizures, and even death. Symptoms may include muscle weakness, fatigue, heart palpitations, confusion, seizures, and irregular heartbeat. Number 10. Bowel obstruction. According to the National Institute of Medicine, PubMed, in some cases, activated charcoal can form an almost solid chalk-like mass within the intestines, leading to a bowel obstruction. This is more likely to occur when charcoal is taken in large quantities or with insufficient fluid intake. The obstruction can prevent the passage of stool and gas, leading to severe abdominal pain, vomiting, constipation, and distension. This is a medical emergency that requires immediate intervention to prevent complications such as intestinal perforation or necrosis. Symptoms may include severe abdominal pain, vomiting, inability to pass gas or stool, bloating, distended abdomen, and dehydration. Number 9. Esophageal perforation. Esophageal perforation, a rare but life-threatening complications, can occur when activated charcoal erodes the lining of the esophagus or when it is aspirated and becomes lodged in the esophagus. According to the National Institute of Medicine, PubMed, this can lead to severe chest pain, difficulty swallowing, and even bleeding. The risk of perforation is heightened in individuals with pre-existing esophageal conditions, such as inflammation of the esophagus, GERD, infections or irritants, or diverticula. This is a medical emergency that requires immediate surgical intervention. Symptoms may include severe chest pain, difficulty swallowing, vomiting, rapid breathing, fever, and shock. Number 8. Aspiration pneumonia. According to the American Thoracic Society, severe aspiration pneumonia, a potentially fatal complication, can occur when large amounts of activated charcoal enter the lungs. This can lead to acute respiratory distress syndrome, ARDS, a condition characterized by severe inflammation and fluid buildup in the lungs. This can lead to respiratory failure and require mechanical ventilation. The risk of severe aspiration pneumonia is heightened in individuals with impaired consciousness or swallowing difficulties. Symptoms may include severe shortness of breath, rapid breathing, blue lips or skin, confusion, chest pain, and loss of consciousness. Number 7. Interference with diagnostic tests. Activated charcoal can interfere with a wide range of diagnostic tests, including imaging studies, blood tests, and stool tests. This can lead to inaccurate results, delaying or preventing accurate diagnosis and treatment. For example, charcoal can absorb substances used in imaging studies, such as contrast agents, leading to poor image quality. It can also interfere with blood tests by binding to substances in the blood, leading to false results. The use of activated charcoal should therefore be disclosed to healthcare providers before any diagnostic tests are performed. Symptoms may include inaccurate test results, delayed diagnosis, worsened symptoms of underlying conditions, anxiety, and increased risk of complications. Number 6. Severe allergic reactions. According to the National Institute of Medicine, PubMed, although rare, severe allergic reactions to activated charcoal can occur. These reactions can range from mild skin rashes to life-threatening anaphylaxis. Anaphylaxis is a severe allergic reaction that can cause difficulty breathing, swelling of the throat, and a drop in blood pressure. This is a medical emergency that requires immediate treatment with epinephrine. Individuals with known allergies should be cautious when consuming activated charcoal, and healthcare providers should be prepared to manage allergic reactions. Symptoms may include hives, itching, swelling, difficulty breathing, wheezing, and anaphylaxis. Number 5. Exacerbation of existing gastrointestinal conditions. According to the Crohn's and Colitis Foundation, activated charcoal can exacerbate existing gastrointestinal conditions, such as inflammatory bowel disease, IBD. The desire for a detoxifying regimen may inadvertently worsen pre-existing digestive problems. Activated charcoal can irritate the gut lining and disrupt bowel movements, exacerbating symptoms in individuals with IBD. This can lead to increased inflammation and discomfort. Symptoms may include increased abdominal pain, diarrhea, fatigue, weight loss, and fever. Number 4. Potential for lung damage, chronic use. According to the Environmental Protection Agency, EPA, inhalation of activated charcoal dust can lead to lung damage. Prolonged exposure to activated charcoal dust can cause inflammation and fibrosis in the lungs. This can lead to chronic respiratory problems and reduced lung function. This is more likely to occur in occupational settings where activated charcoal is handled in powder form. Symptoms may include chronic cough, shortness of breath, chest tightness, wheezing, fatigue, and reduced exercise tolerance. Number 3. Risk of intestinal perforation. According to the American Society of Colon and Rectal Surgeons, intestinal perforation can occur when activated charcoal erodes the intestinal lining or when it forms a dense mass that causes a blockage. This is a medical emergency that requires immediate treatment. This is a very rare event, but it is important to be aware of the possibility. Symptoms may include severe abdominal pain, vomiting, fever, rapid heart rate, low blood pressure, and shock. Number 2. Risk of cardiac arrest in rare severe cases. According to the American Heart Association, severe electrolyte imbalances, particularly potassium and magnesium, can disrupt heart rhythm and lead to cardiac arrest. This is more likely to occur in individuals with pre-existing heart conditions or kidney problems. This is a very rare event, but it is important to be aware of the possibility. Symptoms may include chest pain, shortness of breath, fainting, seizures, irregular heartbeat, and loss of consciousness. Now, for the darkest side effect we discovered about consuming activated charcoal, which is very common. Number 1. It can cause digestive damage and gut damage. According to the National Institute of Medicine, PubMed, while activated charcoal adsorbs toxins, continuous consumption will destroy digestive enzymes in the stomach and disrupt the delicate balance of the gut microbiome, creating an environment ripe for digestive issues and inflammation. Activated charcoal can clear out all digestive enzymes with good and bad bacteria, plus its abrasive nature can irritate the intestinal lining, weakening the tight junctions that maintain the gut's integrity. This compromise allows undigested food particles, bacterial toxins, and other harmful substances to seep into the bloodstream, triggering a systemic inflammatory response. The constant binding of nutrients by the charcoal can also deprive the gut lining of essential building blocks for repair, further exacerbating the damage. This chronic assault on the intestinal barrier can lead to a state of increased permeability where the gut becomes leaky, allowing a cascade of immune reactions and systemic health problems. Symptoms of this gut damage can manifest as persistent indigestion, bloating, chronic fatigue, food sensitivities, slowed digestion, skin conditions like eczema or acne, joint pain, brain fog, insomnia, blurry vision, estrogen overproduction, weight gain, and autoimmune responses. With the gut becoming leaky and toxins leaving the gut and entering the bloodstream, this could set the foundation for systematic inflammation, from which insulin resistance, diabetes, and a long list of other diseases could develop over time. This disruption from overconsumption of activated charcoal can create a cycle of inflammation and damage, making it increasingly difficult for the gut to heal and function properly. Now that you know the side effects, let's turn our focus to the best practices, so you can minimize the effects of consuming activated charcoal. Here are 15 best practices to protect yourself from potential activated charcoal damage. This video contains affiliate links from which we'll receive a small commission. Number 1. Heal your gut. Gut healing is ground zero. Take supplements like the ones listed in our video description below to obtain gut protection and to help repair any gut damage that might have occurred from this or any other gut-damaging foods. These supplements are potent and therefore very effective in helping to restore digestive health, repair your gut lining, and repopulate your gut with healthy nutrients in order to restore gut and digestive health. They will also, over time, relieve some of the above side effects that you might be currently experiencing. Number 2. Support gut health by incorporating fermented foods, probiotics, and prebiotics to support a healthy gut microbiome and minimize gut damage. About 2 hours after taking activated charcoal, and for at least the next 5 days, consume a wide variety of low-sugar fruits and low-lectin and low-oxalate vegetables in an effort to more quickly repopulate your body with good bacteria and replenish it with nutrients needed for gut healing. Number 3. It's for short-term use only. Avoid long-term or continuous use of activated charcoal. It's generally intended for short-term acute situations. Number 4. Proper hydration. Drink plenty of water before, during, and after taking activated charcoal to minimize dehydration and constipation. Number 5. Separate from medications. Allow at least 2 to 3 hours between taking activated charcoal and any medications, supplements, or vitamins to prevent interference with absorption. Number 6. Avoid with existing conditions. Do not use activated charcoal if you have bowel obstruction, gastrointestinal issues, or other serious digestive conditions. Number 7. Monitor for adverse reactions. Pay close attention to any unusual symptoms, such as severe abdominal pain, vomiting, or difficulty breathing, and seek immediate medical attention if they occur. Number 8. Avoid if you have swallowing difficulties. Individuals with swallowing difficulties or impaired consciousness should avoid activated charcoal due to the risk of aspiration. Number 9. Nutrient supplementation. If you use activated charcoal, consider supplementing with essential vitamins and minerals to compensate for potential malabsorption. Number 10. High fiber diet. Maintaining a high fiber diet is very important to try to reduce constipation. Number 11. Avoid during pregnancy or during breastfeeding. Pregnant or breastfeeding women should avoid activated charcoal unless specifically directed by a doctor. Number 12. Don't inhale dust. Avoid inhaling activated charcoal dust, as it can cause respiratory problems. Number 13. Use reputable sources. If you must use it, purchase activated charcoal from reputable sources to ensure quality and purity. Number 14. Don't use for general detox. Avoid using activated charcoal for general detox or cleansing purposes, as the risks often outweigh the benefits. Number 15. Consider alternatives. Explore alternative methods for supporting detoxification and digestive health, such as a balanced diet, adequate hydration, and regular exercise. Now guess what? You have just increased your healthy food IQ. Well done. Here now are 10 amazing health benefits of drinking activated charcoal. Number 1. Emergency poison treatment. Activated charcoal is highly effective in absorbing and removing certain poisons and toxins from the digestive tract, preventing their absorption into the bloodstream. Number 2. Drug overdose management. It can be used in emergency situations to reduce the absorption of certain drugs, minimizing their toxic effects. Number 3. Reducing intestinal gas. In some cases, activated charcoal may help reduce intestinal gas and bloating by absorbing gas-producing byproduct. Number 4. Lowering cholesterol levels. Some studies suggest that activated charcoal may help lower LDL bad cholesterol levels, but more research is needed. Number 5. Kidney function support. In patients with chronic kidney disease, activated charcoal may help remove waste products from the blood, reducing the burden on the kidneys. Number 6. Wound healing. When applied topically, activated charcoal dressings can help absorb bacteria and toxins from wounds, promoting healing. Number 7. Water filtration. Activated charcoal is commonly used in water filters to remove impurities and improve water quality. Number 8. Teeth whitening. Some people use activated charcoal toothpaste or powder to whiten teeth. Persons wearing dental crowns should be careful, as charcoal particles can get lodged between teeth and crown, making mouth more susceptible to growth of bacteria. Number 9. Skincare. Activated charcoal is sometimes used in skincare products to absorb excess oil and impurities from the skin. Number 10. Reducing symptoms of bile flow problems. In some situations, it may help reduce the symptoms of bile flow problems by binding to bile acids. Number 11. Help with mycotoxin exposure. It may help in the removal of toxins from the body. Number 12. Help with certain types of diarrhea. It may help to absorb the bacteria or toxins, causing some types of diarrhea. Number 13. Reducing uremic pruritus. It can reduce itching associated with uremia. Number 14. Help with certain types of insect bites. It can help absorb toxins from certain insect bites. Number 15. Help with certain types of snake bites. In some cases, it may be used along with other treatments for certain snake bites. So there you have it, 18 dark side effects of drinking activated charcoal, plus 15 best practices, and 10 health benefits. Please like and subscribe to our channel so we can continually improve your healthy food IQ.